Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
And good morning to you all. Welcome to today's professional. And in the studio with us is Dr. Wesley Shankland from Lima Dental Associates. Good morning again.
Morning, George. How are you?
Just fine.
Good.
And you, sir?
I'm great, thank you.
Good. So I understand you want to talk today about the tongue?
The tongue. Doesn't that seem silly?
Yeah.
But you know, the tongue, I just think about this. Does it ever get you in trouble? Of course it does. Look at the book of James. It says that little smallest member of our body is like a big rudder on a ship. And it causes us to go here and there. Yeah. And I usually open my mouth and insert my feet. So my tongue does get me in trouble. But today, we're going to talk about the importance of the tongue. The tongue is used to help us swallow, to help us, when a baby is born, help the baby suck, or you and me suck on a straw. We push the nipple or the pacifier up against the roof of our mouth. It helps us swallow, initiate swallowing. Mm-hmm. The tongue helps us talk, of course. The tongue is used also for us to sense different temperatures as we put something in our mouth, help us begin to taste things, and there are areas in our tongue specific for sour and sweet and salty areas like that. A lot of people look at the tongue and they'll come to see me and they'll be afraid they have cancer or some kind of tumor. And we all have these little thing called filaments or little taste buds on our tongue. Yeah. But in the back further, we have these little things called circumvallate papillae, which almost look like tumors if you've never seen them. Now, people tonight, when they brush their tongue or brush their teeth, they should brush their tongue, stick their tongue way out on the back of their tongue. They'll see these little things. There are multiple ones, circumvallate papillae. And those are big taste buds. They're not abnormal, they're normal. They're normal. And you go back further, you even have what's called lingual tonsils, lymphoid tissue. So a lot's going on with our tongue. But our tongue helps us move flavor, or move foods, have texture. And also, when we look at people, we can diagnose people with systemic diseases by looking at the tongue.
I was going to say, it's usually how many health issues you can find just by looking
many.
at it.
And one that we deal with in dentistry is obstructive sleep apnea. I have some pictures going to be on the screen showing the tongue. On the side, it become furrowed. It can be reddened and swollen. It can be coated with obstructive sleep apnea. That helps us look at somebody and say, maybe you have apnea. We have to get a sleep test for you. So the tongue's like the barometer of the body. Right. Important structure in our mouth.
You can notice it just when your tongue bothers you, then obviously. That's
right. You know how bad it is when you burn it on pizza or on a hot drink. Right. It's very sensitive, very sensitive.
Any final words?
Keep smiling, sharing, and caring.
Thanks, Wes.
Thank you, George.